Good afternoon, everyone. We continue the English lecture of modern tongue diagnostics. Today's lecture we have two doctor will give this speech. First, let me introduce Dr. Haiyan Mao. With a great passion for caring and helping people, she started her long journey of learning traditional Chinese medicine from the age of 15. She received her bachelor's degree in TCM in 1993, master's degree of TCM in 1996, and a doctoral degree of TCM in 1999. She had been working as a lecturer in Shandong University of Traditional Chinese Medicine for 6 years from 1999 to 2005. She converted from teaching to practicing TCM since moving to Cardiff, UK in 2005, and has gained a very good reputation locally. Set up her own business, Dr. Mao Acupuncture and Herbal, in 2007. She finished the training course of modern tongue diagnostics in Chinese medicine from Dr. Hong Chun-Yin in 2016. This has dramatically helped to improve her clinical skills. Now, let's welcome Dr. Mao have the lecture.
Thank you, Dr. Yin. Good afternoon, everyone. I think I saw a few familiar faces here. Hello. Okay, today, so I would like to introduce something about modern tongue diagnostics and Qi disorder. I believe if you already had listened to the lecture from last week, so you already know lots of things about modern tongue diagnostics from Dr. Yin. So today we don't need to introduce who is Dr. Yin, what's the principles of modern tongue diagnostics. We will just straight into the Qi disorder. Before our introduction about the tongue manifestation about Qi disorder, I think maybe not everyone has already learned about Qi. If you already learned about it, you can just easily ignore this part. I just have very simple introduction about Qi. So in Chinese medicine, Qi refers to the vital energy that flows throughout the body and is essential to survival of life. So this life is not only showing physically. For example, the Qi we say in Chinese medicine is a force behind movement. Only the Qi help you to move every movement, and also is a source of warmth. Also help you to protect human being from some factors could cause diseases, and also help to govern metabolism. And at the same time, it is very important for our mental health. It's the basis of our emotion, psychology, spirit part. It's all based on the Qi. Just very simple example. For example, some people, they think always negatively. For not obvious reason, they always want to cry. Why? Maybe nothing really needs to cry. And then after we see the patient, we may say, okay, your heart Qi energy is not enough. So we can understand why we say the Qi has very close relation with your emotion, with your mental health as well. So in this lecture, we will talk something about Qi disorder, how it shows in the tongue. And if we already know something about qi, we know qi, there's a very important concept about or character about qi. It is visible. We can't see it. So how can we diagnose it if we can't see? How about when the qi got disorder, no matter if qi deficiency or stagnation, or abnormal qi movement or qi scattering, how can we see? We couldn't see before. Not until Dr. Yin introduced his modern time diagnostics. And then you will understand why we say Dr. Yin, it changed the invisible qi to visible, how we can see it. And also before we talk about that very important concept we used in the time diagnostics, which is time midline. So only for the name we know time midline is the line from the tape to the base of the tongue, which separates the tongue lengthways into the left and right half. A normal tongue midline is the straight line down the middle of the tongue. It should not curve, should not bulge in any direction at any point. But if you noticed it deviated or curved or arched or taped, they all may indicate something. So there's a few points we need to remember how to draw the midline. Often we determine the midline using the natural groove on the upper surface of the tongue. Use the tip-top point at the beginning and the lowest point at the base at the finish. You see that's the example here. It's not very easy. You think it's easy, but sometimes it's not very easy. But this time, sometimes when we draw, we could easily follow the cracks there to draw it this way. But actually, the right correct midline, it should be like this one. So it needs some practice to learn how to draw a proper midline. Okay, let's see how the teeth movement can show from the tongue. We mentioned the qi always flow, always circulated. So how it's circulated, how it moves. In Chinese medicine, we believe the qi as a principle is ascending or lifting or rising up in the left in our body. So accordingly, it is the same on our tongue and descending in the right. With the tongue, even we can't see qi, but we can see from here, it moves up, down, from left to right. That's as a whole, we see generally left, right, and more detailed. It is the few like up and down partners. For example, in the middle jaw, we see spleen qi ascending, but stomach qi descending. It's like the axis in the body. It's very important. So in whatever time, we have to make sure our digestion working properly. It's the very center of the movement in our body. And the liver qi moves upwards from the left. Lung qi moves downwards from the right. Another one is the kidney and the heart. Kidney water ascending to balance heart fire and heart fire descending to warm up kidney water. So that's very often we see these three paths. So the first, very often we can see in our practice is Qi deficiency. How we can diagnose Qi deficiency? The first sign, it could show like enlarged and thickened tongue, or even you can see the tooth marks on the edge.
Gone off there.
Normally, the color of the tongue is pale, not a pinky one, not a red one, it's pale. So that's the first sign. And the second sign of Qi deficiency is depression or dent on the tongue. Of course, if the depression or dent show on different parts of the tongue, it's got different meaning. For example, if the pressing on upper jaw, as Dr. Yin already taught us, so it's where the heart and the lungs, that's upper jaw from here. If we see the dent there, now it's easily you can see what deficiency, heart deficiency or lung qi deficiency. Or if the depression on middle jaw, where the spleen. So it means spleen qi deficiency. That's easy now. If depression on the lower jaw, it indicates kidney qi deficiency. Yeah, here are two examples showing us where the qi deficiency is. So from that, now you can diagnose it very easily. You can see where the depression,
there.
the heart area and the spleen area.
Yeah.
You can diagnose it as heart and spleen qi deficiency. This one is very obvious. It's here, the lungs area and spleen area. So we can diagnose this patient as lung and spleen qi deficiency. I remember this quite long time patient. She got asthma. So we can understand. So from this time, why we see when we treat asthma, not only treat lung condition, we have to treat the
yes, deep
not just theoretically we need to. It's give us evidence. We have to. So the second qi disorder, very often we can see in our practice, which is qi stagnation. What we can see, why we can diagnose we got qi stagnation, what kind of sign from the tongue. It is, now we can use the midline now. If the midline has divination, and then it means different meaning. Move to right or move to left. If the midline deviates to right, from here, not in the middle, to the right side, what is mean? Remember when we see the qi movement up and down, which organ ascending? It's the liver qi. So the liver qi should right up on the left, but if we see the left side bigger than right side, we can diagnose it as liver, even the gallbladder qi stagnation. When we see this, we mentioned the qi linked to our emotion very closely. So emotionally, patient could have lots of stress, anger, that's emotionally. And very often this kind of stagnation, if you ask a patient if you're good to release your emotion or not good or hold it, very often the patient will tell you they're not very good to show their emotion. They try to be polite, try to have good manner, but they feel it. they hold it inside. So that's why just like to blow a balloon, make the left side bigger and bigger. So physically, the patient can feel pain on the side of the body. If the other way, the midline moved to the left side, and now it should be normally it's lungs Qi descending from the right side. So if the midline move to the left, it means right side bigger than left side. And now it's easy for you, I believe. You can diagnose it with the lung and large intestine Qi stagnation. Of course, in practical, you can ask patients if they have cough, if they have any breathing difficulties, or if any constipation. So that's why sometimes after we take a picture, after we read the tongue picture, we can help patients some symptoms they didn't tell you. That's why from there we know. And the second sign of Qi stagnation is local bulge on the tongue. Because bulge or swelling, if happens on both sides of the tongue, it indicates the same as big left side, stagnation of liver and gallbladder Qi. So when we diagnose that, we can easily to choose the correct treatment. If the bulge happens in the middle area, middle jaw, so what that indicates? Of course, it indicates the stomach Qi stagnation. Here there is the example here. We have a case here, we go through it quickly. So this patient come to ask for help for acne. But after taking the tongue picture, we easily diagnose some other symptoms or some other problems. We can see the stagnation happens, the bulge in the middle and the right lower part. Also, if you have constipation, that's a yes. That's only open bowel 1 to 2, not per day, per week. That's not enough. That's poisonous. So that's one of the very important reasons to got the acne. And also from here, remember the picture showing here is the nose area. So we can see some dark spots on the very tip. So we just ask if you have any sinus problem. They said yes as well. So from this tongue picture, we got the diagnostic as pitching upper jaw, liver Qi stagnation, and stomach Qi stagnation, and large intestine failed to descend. So according to the diagnostics, we can give either herbs or acupuncture, and then we can have better effect. So after 2 week treatment, the acne disappeared and bowel movement much better as well. Here is a very interesting case as well. This is a patient, she came and told me she got breast infection. And then said, yeah, my GP, it happened before, my GP gave me antibiotics and cleared it, and this time flared up again. So don't want to take antibiotics all the time, so want to try acupuncture and herbs, something like that. And then with the tongue, we can see that's where the breast is showing. It's the left breast, we can see the bulge. So from this patient, when you touch the breast, it feels like rock, very hot, so very suspicious. I really strongly suggest to her to have more checkup, and then it's found out she got breast cancer. So after when they found the breast cancer, it's already, I think, moved to her lung and the spine. Can't do the operation, so they only give her chemotherapy. This one is after the chemotherapy, the breast size back to normal size, and compare with this one, that's back to normal size. And also the bulge, you can't tell any sign of the bulge now. So that just give us the idea how the breast showing from the tongue. So another sign we often see in our practice is the cracks. So the cracks, it could have, if you have learned the traditional tongue diagnosis, you know, or got some other reasons. For example, like if you have yin deficiency or blood stasis or dampness, this all can cause a crack. But whatever reason, there always one reason, always there, the teeth stagnation. So it's always right when you see the crack to treat teeth stagnation and find out what else reason you can find. So the other one, abnormality ascending or descending, we'll see later. It's the first one is liver T upsurge. It's very typical. You can see either it's an arrowhead-shaped tongue tip, like this one, very sharp, or you can see a sharp arrow-shaped. The second one, let me see if we have another picture. This one. That's a flat tip, but still arrow-shaped. It's like, look like a very friendly arrow. You don't want to hurt people, you just blunt it. So it's this one also, it means liver T upsurge. That's the second sign. The third sign, it could show like left tongue tip protrusion. Sometimes we will have the example later, next page. If upsurge liver T had converted into fire, at the same time when we see the arrow-head-shaped tongue, also showing the color changes to red, so red tip or red spots on the tip when it's converted to fire. Here is another case. So this patient is 20 years young man. He got headache and bottom tooth pain on the left side. Now we can see the tongue shape. It's like arrowhead shaped and round tongue tip, swollen side, and a depression in the middle. So from the knowledge we just introduced, you can make the diagnostics now. Bulge here, blocked liver and gallbladder T. Also the redness converted into fire. Arrowhead shape, liver T upsurge. Depression there, spleen T deficiency. So this one, because it's not face-to-face patient, it only from the something like the WhatsApp somewhere asked for help. So I couldn't to perform the acupuncture. I just told him something to quickly release the headache and the toothache. So just asked him to use the large intestine 10, or we call it Shosandi, to do some acupressure that temporarily helped to control some of the pain. And then asked him to buy in Chinese we call it 加味逍遥丸 or eat pill plus. This one is just can be used for this condition. And let's see, this case is also to show us what's the liver T upsurge. The chief complaints is gum bleeding, stomach bloating, and PMT. From stem, we can see the U shaped, or sometimes we can just describe it as horse hoof shape, like this one, or bulge around, only depressed in the middle and the base. Left tongue tip is not leveled as the right, so it has a protrusion. And according to that sign, we can diagnose it as liver T stagnation and upsurge. Upper jaw T stagnation converted into heat or fire, spleen and kidney deficiency. We give the correct treatment according to the sign. So if you know the points well, you will understand why we choose that point. All points or herbs, every single one, it comes to correspond to the different sign in the tongue. That's the points we chose. And then after treatment, can you tell the difference? It's leveled and not as bulge as before. You can see it has a big change. And of course, the bleeding stopped. Stomach bloating much better. She even managed to lose some weight. She said, oh yeah, I felt my jeans getting much looser now. I could have my old jeans. And the PMT not that bad. This case has been there for quite a few years. And now this lady only comes before period for one treatment every month. And the gum bleeding never happened again. So this number 3 case about liver T upsurge. If you pay some attention, you will see them very, very often. It may be because of the pressure, stress from work, from life. A lot of people have this kind of tongue. So this one, we call it the blunt arrowhead shaped or pointed flat tongue. It can be diagnosed as blocked liver T converted because of redness into fire, liver T upsurge, liver blood deficiency. Here is another diagnosis which have different sign from the tongue. It's showing the straight line or depressed line along the edge, or flat tip, or we can diagnose it as blood deficiency. So according to the tongue, we ask if she had the symptoms like anxiety, stress, insomnia, or headache. So it all happens with this kind of tongue. So this condition is the lung and large intestine fail to descend. This case. So the sign from here, we see the midline. When we draw it, we see it moves to the left side. And the right half much bigger or larger than the left side. So that indicates the lung and large intestine T is blocked. Meanwhile, the T descending is affected. So this case is from Dr. Yin's case. This is a constipation patient. Dr. Yin gave this diagnosis, deficiency, depression here, lung and large intestine T failed to descend due to the right side blockage. And the treatment, I think Dr. Yin used some pills, 健脾丸 and 健脾 pills and 润肠 pills. It works very well. The other sign is the adverse rising of stomach Qi. As normal, we know stomach Qi should move down, not move up. So when something wrong, it can't move down properly, it could adverse rising. It can be further developed from the stagnation of stomach Qi. The tongue sign showing like the middle jaw of the tongue or even the entire midline is raised up, like this one. Actually, this patient, he came, I remember, for lower back, hip pain on the left side. So the pain degree, didn't write down that, but here it's 8 to 9 out of 10, very painful, unbearable. So already 1.5 years. So this is the diagnosis according to time. But because of this sign, not only just treated his pain problem, also asked if he got some stomach problem. So he just told me he confirmed he had stomach bloating and burping a lot, occasionally acid reflux. So we can tell lots more than only the complaints. So this one is the disharmony between heart and kidney. So physiology side, the heart fire we know should warm up kidney water to rising up to help heart. In pathology, heart fire floating on top, kidney water becoming cold. They're not helping each other, they separated. So it's showing very typical tongue sign as red tip, but white on the lower jaw on the base of the tongue. So for this kind of tongue, if you don't know about modern tongue diagnostics, it could be easily mistreated. You could just treat the head, but actually the patient couldn't bear that cold treatment. Or if you see because of complaints, some coolness, you only give warm treatment, and then the fire there not agree with it. So only when you learn the Dr. Ing's modern tongue diagnostics, you know how to treat it. There's a very special treatment Dr. Ing told us. It's called guide fire back to kidneys. So there are 3 very useful points can do this job. It's the Haiyan 2 or Ren 22, 巨缺 Ren 14, and 官员 Ren 4. So these 3 can help this kind of tongue. So that is the case. The complaints about depression, insomnia, stomach problem, and ED. So this is the patient's problem. So the second case, the main complaints are freezing cold feeling in legs, easy to feel, to have acne and gum bleeding. So if you don't know about this type of tongue, you feel very confused. How can I treat it? You feel cold, I give something warm, but your acne may be getting worse. If I treat your acne, maybe the treatment too cold, you feel even colder. So we just, according to this kind of tongue, here is the example how we choose the herbs. For example, here we can use the bohe to clear the heat, floated heat. Here, that is a crack. That's how we use another very good part of the modern tongue diagnostics. What you see in the tongue, you know exactly what herbs you can use. So with the crack in the heart area, we use giganta. and the lower jaw coolness or the white showing young deficiency or coolness, we use 兔狮子, 炒薏仁. If in the middle part, we use 干姜, 炒白术. And the blockade on the side, if blocked on the right, we use 智翘, and 杏仁 have to move the teeth downwards. If the left side bulge, or sometimes if some swollen, we use 柴胡, sometimes 白芍 or try 牛膝. So what you see, you write down the herbs images on some picture, you got your prescription. So that's how we got this prescription to treat the patient. And then we talk about the crack on the tongue. Could have lots of different reasons. It could happen in the midline of the tongue or in a certain part of the tongue. And the treatment will be it depends on where you find the crack. And then to see where the internal organ should be there. It's done all through according to the location of the crack. And then from that, you can choose like the example here, crack here, we choose this herb, to choose crack herb or acupuncture points. If it happens in hot area, we use ginseng, or sometimes you can use dangshen to replace it. Or if it's more to red color, we use madong. If it's more to dark color, we use guizhi, or we can use wuizi to hold it, to make the crack. If it happens in stomach area, it means stomach qi scattering. Also, we can use dangshen, baizhu. If in kidney area, it means kidney qi scattering. We can use yizhiren, duzhong. Of course, many more we can choose. Here, just an example. Or if the crack happens in the middle, we see acupuncture, we can use the corresponding Hua Tuo Jia Ji points. That's a very helpful method Dr. Yin introduced. When you find the midline crack, you can just use the acupuncture needle and then to find the tendon point, to put the needle towards the spine, best to touch the lining of the spine part, the bone part, and then to fix the crack. So if after this treatment, you can see the crack getting smaller and smaller, even healed. Here are some examples about qi scattering. So this one is the heart qi scattering. This one is the stomach qi scattering. This one is the stomach and heart qi scattering. So from that, you can choose the correct treatment. There's some more examples. This one is a post-COVID. There's some fatigue, some other problem. So the tongue showing lung and heart qi scattering. And this one is sleep disc patient and also showing heart and stomach qi scattering. Some more examples. This one is the infertility patient. You see from the heart, stomach, and kidney area all got the cracks. We have the scattering all for different parts of the body. So when you do the treatment, you can't just say, okay, kidney in charge of your reproduction, only to boost kidney. But if you find this kind of sign, you can not only treat kidney. So this patient got diabetes, back pain, joint pain, COPD, hiatus hernia. So from this time, we can diagnose it with heart and lung and stomach tissue scattering. Here we have a case, we can go through it. This patient is a lady. She got chest pain and syncope. So the main complaint is chest pain for 5 months' time. So her history is quite interesting. She got chest pain started before 2017, so that's quite a while. At the beginning, the pain appeared once every 4 to 6 weeks and spread from front to both sides of the chest. So on December 20th, there was one episode. She felt a burning pain in her chest. It gradually expanded like a fireball. That's, she told me, like a fireball until it exploded. Then the burning sensation spread to her hands. So she fainted at the moment she felt the hot feeling spreading to the hands. After being awakened, she had been to hospital and had lots of tests, including brain CT, chest CT, ECG, and various blood tests, but no positive findings. So that's very weird. She really got a problem, but no findings. Afterwards, chest pain occurred more frequently than before. There were 2 episodes occurred 2 weeks before the visit to me, I mean, but no more faintings. So urinate 2-3 times a night, which disturbs her sleep, slightly lack of energy. So here is the time. You see here, you can understand why the discomfort happens in the chest area. It's really, you can tell, even you don't know the count diagnostic, you can see, oh, there's something wrong there, not right. It's not even, it's up and down, something like bumped. So if you have learned the modern count diagnostics, you know what problem that is. So the pulse, you just can see it. We don't really depending on the pulse that much. So the tongue is light purple, midline moves to left, swelling side, upper jaw raises up, and also can see the like uneven surface and light greasy and light yellow tongue coating, depressed mid-jaw. So according to that, we diagnosed the condition as liver T stagnation and spleen T deficiency. T blocked by dampness and heat, and lung T fails to descend. So therefore, I chose the points 百会、印堂、膻中 and 中脘. That's the upper part, and the left choose 外观. You can see if you just learned the number, you can see the number referred here. 外观合谷、阴陵泉、太冲. Right side, I use 丰隆、阳陵泉 and 阳府. So sometimes people may ask why you use different points for different sides. I think that's maybe just my habit. And also I think because of Q's movement, our Qi always move up from the left, move down from the right. So if I choose some point, want to help them to move down that Qi, I choose more likely to use the right side points. If I like to help to lift up their energy, I use the left side points. And we use the herbal treatment as well. 瓜蒌皮 黄连、半夏、陈皮、石菖蒲。Have some more, maybe this one is too big to show. But anyway, the herbs we choose according to the tongue sounds. Oh yeah, we have here in Chinese, I can read to you. 石菖蒲、柴胡、黄芩、香附、白术、黄芪、干姜、甘草、厚朴、炒杏仁、薏仁、白蔻仁、冬瓜仁、熟大黄、桑寄生。That's all according to the tongue sign to give different herbs. So from the second visit, she said the chest pain has not recurred, and the thinking is clearer than before. Energy has increased, only urinate once at night, and sleep improves. So the tongue can tell the difference now. Even still not normal, but it's already improved. The color improved, the bulge there improves, and then the shape, the coating improves. So the treatment we just carry on because it's effective. So since then, she had acupuncture treatment once a week, with herbs for 5 weeks. Followed by this, only have acupuncture once a week or other week, every other week until 12th of May 2018. During this period, there was only one felt mild chest pain, which lasted for a short time on this day. She has been feeling well since then. The picture on the left is the tongue photo at the last visit. So obviously it's not normal tongue, but you can focus here. It's not bumpy. It's more even, so she doesn't feel that chest complaint then. Of course, if she could carry on with treatment, she will get some more benefits. So the other one is a quite interesting case I would like to share with you. So this patient got phantom limb pain. She was by that time 71 years old. So that was 2019. The pain in left leg. The history, like the patient had a surgical debridement in 2015 due to an infected ulcer on the left leg and a hip bone infection. After that, the skin infection continued to reoccur, and multiple antibiotic infusion treatments failed to control the infection. So she had amputation up to upper leg in October 2016. After the operation, phantom limb pain started, accompanied by tingling extended from the left sole to the entire calf and outside of leg, which not exist. The pain level can reach 9 out of 10. Pains made her screaming. Sometimes she felt stress and anxiety, low appetite, shallow breathing, dry mouth, insomnia, and body enlarged sensation. So apart from the pulse, we can see the tongue. As the tongue showing right, red, left, pale. Right is red, left, pale, with little coating. The midline deviated to the right side. The tip of the tongue is flat. The tongue surface is wrinkled and cracked. And tongue base is depressed. The upper jaw is raised. And the corresponding part of the left lower limb on the tongue is atrophic. You can see here. That's where the legs should be shown there. So the diagnosis was disharmony between body and mind, Qi and Yin deficiency, Qi and blood stagnation. liver blood deficiency. So we give the treatment like regulate Shen or mind, use 百会神门 and the right corresponding area of the lower limbs and sensory zone of scalp acupuncture. And at the same time, maintain physical body via regulating qi, because we couldn't perform the needles and bottom limb. It's not there. How can you put needles there? So we use the balance treatment. If you know something about that, you can have a look. So we choose the right side, small intestine 5, Sanjiao 4, large intestine 5, Sanjiao 3, large intestine 10, Sanjiao 9, which is 阳谷、阳池、阳溪、中主、手三里四度. Here is the we call it is the same named meridians treatment. And then the left side we use 神门 heart 7, 曲子 lungs 5, 曲子 pericardium 3, and some ash points. So we have kept the needles for 20 minutes. And then after 20 minutes, the patient reported feeling calm, breathing becoming deeper, and the bottom limb pain disappeared temporarily. Only a moving thing left. So after that, the following treatment was once a week. The pain kept reducing every time. Mood improved. So altogether, she had received 8 treatments in total by July 15th. Only felt pain occasionally. And even occasionally happens, the pain wasn't too bad, only about 2 out of 10, so which quite bearable. The patient was able to install a prosthetic. So by the end, we can see the tongue showing much big improvements. So the stagnation of the teeth has been improved. Can you see the difference between the two? So that's what time I saw her. That's the 2019, before COVID. So during COVID, I didn't see her. The second part of COVID, I saw her neighbor. Very sad story. Her neighbor, I asked about her condition. Her neighbor said 2 years ago, she got pancreas cancer. She gave up, didn't receive any treatment, and then she passed away. So very sad to hear that. But I think she left us a very good case. So that's a respect to her as well. Okay, so that's some meetings we have held. Dr. In to introduce something here, Dr. In, me, Dr. Sun, and I was giving lecture there. Okay, this is last year's in Dr. In's huge house. So we had this lecture. That was really happy time as well. Okay, so that's today's introduction. Here is some information if you're interested with modern tongue diagnostics. This is Facebook messenger code. You can use this one, or that's the website address. So you can, you're welcome to join us. Thank you very much.
Okay, thank you, Dr. Mao. If anyone has any question, you can ask her.
Hi, Dr. Mel, can you hear me?
Yes, please.
I just wanted to clarify, when you were, I think approximately in the first couple of slides, 1, 2, 3, 4, 5, 6, 7, slide number 7.
Okay, so would you like me to share it again? 1 second.
It has a picture of the tongue,
Yes.
the
So,
ascending, descending diagram.
yeah, no problem. I'll get it now. 1, 2, 3, 4. This one? With the picture about ascending and
Yep.
descending, this one, yeah.
Yes. So when you say that the qi movement is ascending in the left,
And
so it's moving
descending.
up
Yeah,
on the left.
yeah, on the left, with the left. We mean the left is the patient's left. Here, that's left.
The
right.
patient left. Okay,
Yeah,
so it's
patient left, yeah.
when you say, so in the photo,
Yeah,
it shows the arrow pointing down
yeah,
and the word is ascending.
ascending, yeah. Arrow because
Yeah.
you see, you can imagine when the blocked energy more and more, it got like find a way to go out. And the T is like has the character, it tends to going up. So it can choose to developing from the blockage and then up from there.
Okay, so
And
when you
that-
say qi
yeah, it's
ascending, you mean
ascending,
it's
yeah, ascending, yeah.
pathology? You mean it's pathology, not it.
Oh yeah, if
So
you got the arrow-shaped tongue tip, it can't be normal. It's abnormal.
so this is abnormal.
Yes, yeah, the arrow shape, that's when we talk about the pathology. That's abnormal. This is normal.
Okay.
That's normal sign. Normal way should be like that. That's all when we talk about the abnormal. See, yeah, the T disorder.
Okay.
That's all under this topic.
So the liver, the qi of the liver, when it's normal,
Yeah.
it should be going down.
Oh no, it's normally it's going up, but going down because it circulates from bottom, from left side up, and down from right side. But you can't see the tongue just showing normal shape, no bulge, no middle line deviation. So that's normal.
Okay. In the next slide with the colorful photo or
Photo case or
so slide number 8.
number 8. Number 8. This one is number 8, yeah. That's a normal condition. As a normal body, healthy body, it should have this. The T should always keep moving. It's not just stay there.
Okay, so this photo is normal movement.
That's right.
Okay.
So we see the T's movement, it means a normal movement.
Yep. So the metal is moving up and the wood is moving down.
Oh, sorry, you got it wrong. I don't know if you had that. Dr. Yin could give us that picture with the little baby laying on the tongue. So can show you. That picture showing that's the head here, and then the baby just
I see what you
down.
mean. Okay.
So it's
Okay.
this is not on the pictures up or down. You can imagine it. It's like a body lay down here, but head here and then the bottom here, leg here, arm here. So for the tongue,
Mhm.
the up part is here, down is there. So that may be what
Okay.
confuse you.
Yes. Okay. That makes
Yeah.
sense. Thank you. Thank you for
Okay, sorry, it's
explaining.
my fault. I saw Dr. Yin just introduced last week. I didn't want to waste your time, so didn't put that picture.
Oh.
Sorry for that.
Thank you.
Okay,
Thank you for
welcome,
explaining.
welcome.
Okay, if no question or if you have a question, you can leave the question in the group, okay? And we'll continue the next session. Next session will performed by Dr. Lu. Let me introduce Dr. Lu. Dr. Lu is graduated from Shandong University, Shandong Medical University, and was trained in gastroenterology before she came to the US for her PhD in epidemiology in the University of the Southern California. After that, she was working at the City of Hope National Medical Center as an assistant professor for several years before she came back to practice medicine. She is currently board certified family medicine physician and has her West Medicine Clinic in California. She has been studying Dr. Yin's modern tongue diagnostics over 4 years, which helps her remarkably in helping patients with all kinds of health issues. Now let's welcome Dr. Lu to give the lecture.
Dr. Yin, why I didn't see I share my screen?
No. Let's see, you get a corporate speech. Let me see. Dr. Lu.
Is it in the share? No.
Yeah, you suppose you get a co-host. Yeah, in the bottom, can you see the share?
Yeah,
Yeah, you just press the
there is one participant can
group.
share at a time. It's still in Dr. Mao.
Okay, Dr. Mao, can you withdraw your share?
I think I stopped it.
You stopped.
Okay.
I think I stopped it.
Why I didn't see it?
Let's see. I didn't use the share.
One moment.
Let me, maybe I leave the meeting to make sure you can use it, and then I come back again, okay?
My screen.
Okay, can you try again?
Let me see, share entire screen. Sound quiet. Let's see. Can you see me now?
Yeah, you has started screen share. Yes, we can see it.
Okay.
Yeah, just make it a full screen.
Right. You can see my screen, right?
Yes.
Okay, so now what I see is you.
Huh?
The wheel this way. Right
I
here.
can see your screen, the PPT. And
Okay.
let's make it in the full screen. Let's see.
If I
Click from beginning.
yeah, I see whoever is talking, I see is in the middle of the screen. I don't see it. Should be in the view. View. Let's see. Option. the whole screen. Let me share again. Why how I minimize this? No. No. This. Give me one moment. You all see my screen.
Yes. No, I just see the PPT.
You see the people.
PPT, yes.
Okay.
The PPT have a clear show on the screen.
Alrighty. Let me see if I think it is the view. It should be on the view. Setting in hide self view had no video participate. Show. Let me first exit full screen. There's still. Okay, if I do this, can you see me?
Yes.
Okay,
You
I
can
will.
see the,
Okay, I will do this. You can see
oh,
the
yeah,
screen.
yeah, you're moving.
Okay, I do this.
Move to your left, keep left, one more left.
Yeah. You
Click,
mean,
click,
yes,
click.
but you can see the screen, right?
Yeah.
This is
Good
correct.
enough. It's good
Okay,
enough.
alrighty. So let's do this. Hi, everyone. Good morning, good afternoon, good evening. So I was trained in Western medicine and I started to learn traditional Chinese medicine from year 2018. And I was very, very lucky since 2020. I started to learn modern tongue diagnostic with Dr. Yin. So it really helped me to understand more deeply about the traditional